you see, a homeless person who needs help, and you give them your whole paycheck. And once that event's over, you realize, oh, I probably shouldn't have done that. So I can't pay my bills now. So your thinking isn't quite clear, no matter what emotional state you're in. So neutral states are the best states for thinking. And a neutral state is when you can just kind of gauge the rationality of your thought, so it doesn't swing you into one emotion or the other. Now, emotions are not all bad. We need emotions. They're survival mechanisms. So emotions kind of tell us what to do when we really can't think what to do. The situation dictates that we do something fast, and our thinking is a little slow in catching up to do that. So our emotions help us to do that. So emotional thinking, some characteristics of emotional thinking are unbalanced, distorted, and limited. So emotional thinking is like being in a tunnel, and you can't see what's outside of it. Characteristics of thinking in a neutral state: it's very balanced, it's rational, it's logical. You have more of an open view of things. You're able to take in more things. You're able to balance and rationalize a little bit better. So when we have distorted emotional thinking, these create cognitive distortions. So there are 15 primary or main cognitive distortions, and we've listed 5 here. So catastrophic thinking, polarized black and white thinking. Has anyone ever heard of these distortions or cognitive distortions? Okay. The next one is overgeneralization, negative filtering, and jumping to conclusions. So those are just some common distortions that people usually experience. There's some more intricate ones as well, but these are the common ones. So distorted thinking patterns usually cause maladaptive behavior. So things like anger, substance abuse, avoidance. When we can't think right, then our behavior is not going to be in line. So maladaptive behavior, simply, it's behavior that's not adaptive. It's not helping you to properly cope with the situation and move on in a healthy way. And adaptive behavior is something that does help you cope. It helps you cope enough to get through the situation in a healthy way, so you're functional. So we are going to do a case conceptualization. So on your sheet, there's a sheet with boxes. Well, there's 2 sheets with boxes, but one has squares that are stacked up on top of each other. One are columns. So we're going to look at the one with boxes. So Brian is a 24-year-old sales representative for a radio station. He recently graduated with his bachelor's in communications. He has a wife and 2-year-old daughter. After Brian's first therapy session with you, you learned that he is having trouble performing at work due to chronic anxiety and doesn't know what's wrong with him. So all he knows is that I'm super anxious at work, and it's been happening for a long time, and it's causing me some disturbance right now. So you give Brian that sheet in your hand. And that sheet is a tracking sheet. It's one of the first sheets that we use in CBT, because therapy really doesn't start until we know what's going on in that person's situation, their environment, their thoughts, their behavior. So therapy kind of takes a person-centered approach for the first few sessions until we can gather some data. So we just work on rapport building until we get at least a week or 2 weeks worth of data from the person filling out these sheets. So these are their homework assignments. They take these home and they fill them out daily with situations that were distressing to them. So Brian filled out a situation where he had to speak to a sales manager about his numbers, and that caused him 90% distress. So that's a high level of distress for that situation. His internal physical sensations, he experienced a racing heart, chest pain, shortness of breath, and sweating while that was happening. His emotion, he was anxious at 85%, so that's pretty close to panic. I mean, you're knocking on the door of panic right there. He felt 60% sad and 80% disappointed. His automatic thoughts were, I can't keep up with this job, and he believed that at a 90%. I'm going to get fired soon. He believed that at a 70%. And why can't I make more sales? He believed that at a 50%. And his behavior after the situation occurred was he cried after the meeting, and he avoided his boss for the rest of the day. So what we also want to do is we want to track Brian's maladaptive behaviors. Now these maladaptive behaviors are unique to anxiety. So as therapists, you can add more maladaptive behaviors that you may feel are relevant to your client. But these are the specific ones that primarily show up in anxiety. So avoidance, safety behaviors, reassurance seeking, worry, post-event rumination, and withdrawal. So Brian's avoidance was that he stays in his cubicle to avoid interactions with his boss. He avoids getting feedback about his performance. His safety behaviors, when meeting with the boss, he holds himself with his arms. So holding himself, he feels that if he doesn't do that, then he's going to feel additionally anxious and possibly have a panic attack. And he also drinks water, which he feels will help him be less anxious. Reassurance seeking, so he constantly needs confidence boosters from his spouse. So things like going home and telling her about his bad day, and then he needs her to kind of pick him up a little bit. Worry, so he meets every Friday with his boss to go over his sales numbers. And as Friday approaches, he worries. He gets more anxious about the upcoming meeting with his boss on Friday. Some more maladaptive behaviors. He engages in post-event rumination. So after attempting to make a sale or after a meeting with his boss, Brian replays all the perceived negative things that happened. And withdrawal. So withdrawal is added in because anxiety and depression often co-occur. So the withdrawal maladaptive behavior really speaks to how depressed that person's anxiety is making them. So Brian has started to become withdrawn from his wife and his 2-year-old daughter. Brian does not engage in things that give him a sense of pleasure like he used to. And Brian enjoys his coworkers, however he rarely feels like interacting with them. So those are huge signs of low mood, possibly being, I still say dysthymic, DSM-4, but possibly being dysthymic, mildly depressed, and majorly, or possibly majorly depressed. So we're going to do a collaborative case conceptualization. So I want one of you who is willing to play Brian. So whoever can look over that sheet and kind of see if they can conceptualize Brian pretty well. You're going to play the role of Brian, and then I'm going to be the therapist, and we're going to try and conceptualize what help it make sense to Brian. Because right now, Brian doesn't understand all this. This is way over his head. So, anyone willing to play Brian?
I'll do it.
Okay.
Okay.
I'll do it.
Okay. So, this heavily relies on helping the client to gain insight. So if you're doing more talking than the client's not gaining insight. So Brian, from what you can see and what we've identified so far, what stands out to you?
I'm just really worried about losing my job.
Mm-hmm.
I think that's the biggest problem. And I don't want to disappoint my wife and my daughter. I need to make money and just graduated with this degree and I have all this debt.
Yeah.
And I just don't want to lose my job and I don't want to disappoint anybody.
So you have a lot of pressure, you have a lot of responsibilities, and that worry, when you worry like that, what's normally the situation that causes that worry?
Just the anxiety of my job and having to speak with my boss.
Mm-hmm. So speaking with your boss and your job causes you a significant amount of anxiety. Which do you think causes you more? Do you think your job causes you the most anxiety, or do you think the interactions with your boss cause you a bit more anxiety?
I think it's the interactions with my boss that cause me the most anxiety.
Yeah. And when you interact with your boss, what do you normally feel when you're doing that?
I feel extremely anxious. I feel incompetent.
Mm-hmm.
Like he doesn't like me, or that I'm not doing the job how he wants me to do it.
Mm-hmm.
I'm basically underperforming and underachieving.
So it seems like your thoughts are causing you to feel a little bit elevated when you meet with your boss. Your thoughts about not performing well.
Mm-hmm.
And after the meetings, what do you notice that we wrote down on those sheets? What do you normally notice after the situation happens with your boss?
I cry a lot,
Mhm.
and then I just try to avoid him for the rest of the day.
Mhm. And what do you think you're avoiding?
I think I'm trying to avoid his evaluation of me. Just if I don't see him, then I'm not thinking about the thoughts of him
Okay.
and his thoughts of me.
Okay. So your boss is almost like a trigger for your anxiety.
Yeah.
And even to go further than that, his evaluations are definitely a trigger for you.
Yeah.
So this is the point where I would ask the client to conceptualize their issue. What do you think is going on? And does anyone want to take a shot at a loose conceptualization of what's going on with Brian? Definitely has something to do with anxiety. Go ahead.
It just seems like he cares a lot about what his boss thinks.
Yeah.
So, going Rogeria, I operate from an external locus of control. He cares about what everybody else thinks instead of what he thinks, how well he did on the job.
Exactly. Exactly. So other people's opinions matter more to him. And those of you who remember psychopathology, the anxiety section, that's a common theme in social anxiety. So, and to go even further, there's a personality type called avoidant personality disorder, and that heavily has to deal with other people's opinions, negative criticism. They almost avoid human interaction because there's a risk of evaluation. So, it could be, so that's going a little bit further diagnostically, but in basic conceptualization with the client, we would just say something like, it seems like you're experiencing some performance or social anxiety with interacting with your boss. So this sounds very basic to us, but a lot of clients, this is way over their heads. So they kind of need some help in conceptualizing what's going on with them. There is a stigma that anxiety is bad. And, a lot of people actually really don't know about social anxiety. They know they get anxious socially, but they don't know that that's an actual disorder. So we're kind of helping to normalize their feelings by conceptualizing it and helping them understand it. So I'm going to walk through quickly how I would treat Brian. So this first sheet is a thought record. We use it in cognitive restructuring. So it goes over thoughts, most distressing thought or meaning, evidence to support the meaning, evidence that does not support the meaning, is this meaning a cognitive distortion, and then it goes over some balanced mind questions. So this section can be thought of as cognitive behavioral, and this section can be thought of as rational emotive. So it's combining two different areas. So evidence for and against, and how could you think about this better? Well, what's more likely? What's a more likely outcome? So Brian's thoughts, he can't keep up with his job, going to get fired soon, why can't I make more sales? The most distressing thought and meaning of that is, I can't keep up with my job, which means I'm subpar and inferior. So that's the meaning that we derived from that. Evidence to support that meaning, I have the lowest amount of sales in my department. So Brian and I have sat together, we've gone over evidence for and against. So these are things that we can actually prove, they're not opinions. My colleagues sell at a faster rate than me. So evidence that does not support the meaning, I've only worked at this job for 2 months. My colleagues frequently tell me the first 6 months are hard, but it gets easier. My boss has never informed me that I'm underperforming. My boss praised me for closing a hard sale last month. So that evidence contradicts the meaning and belief he has. So next we want to identify, is this a cognitive distortion? And Brian and I have agreed, yes, it's a distortion. Why is it a distortion? Well, we want to use those cognitive distortions to kind of identify our type of thinking. So Brian's identified that he's negatively filtering and he's jumping to conclusions. And that kind of helps identify his thinking pattern as opposed to, I'm just thinking in a general way. And these are the balance questions. You guys can kind of read over those. They're in the long column, all the way to the right. The column, or question number 4, in the balance mind question, this one is important because it asks the client, how do you think this meaning came to be? So sometimes that meaning is out of necessity. Sometimes you're just facing some really hard life situations and you develop some thoughts as a result of that. But Brian and I have come up with the fact that came out of fear and opinion. So it's not evidence-based. So next we would try to identify Brian's levels of thought. So automatic thoughts, the meaning, the underlying assumptions, and the core belief. So with the automatic thought, we want to work to create a coping thought to challenge that. For the meaning, we want to try and find the rule behind the meaning, which leads us here to the underlying assumption. When we get to the underlying assumption, that if-then, so if it's dark outside, I don't go out. The rules we have about the world, we want to test those using behavioral experiments. And then for the core belief, we want to track and change that belief. So we want to track how much that belief is shifting by using coping thoughts and testing his assumptions. So by doing those two, our hope is to shift this. You can't really work directly with core beliefs. They're hard to shift. So we work with them indirectly by their underlying assumptions and their automatic thoughts. So that just identifies his automatic thought and the meaning that we identified, that he's subpar, can't keep up with his job. So his underlying assumptions. So we've discovered that Brian's rule is, if I don't perform well right away, then I'll be fired. And his should statement, which is also a component of underlying assumptions, is it is expected I should be able to perform at a high level right away. So those are the rules that he's operating by. So what we're going to do is we're going to test those rules through observation exercises. So we want to observe what happens to coworkers when they fail to close the sale. Brian's going to start being more observant of his colleagues failing, and he's going to see what happens when that happens. Doing role plays with the therapist. So have the therapist play the boss, and I'll just hammer him. I'll make a role play where he'll come to me and about a failure, and I'll just say the meanest things I could possibly say. I'll really give it to him. And then he and I will talk about how likely that is, how likely it would be for his boss to do that to him. Surveys, he can send some random surveys to other sales managers about things he's concerned about, like performance. What do you expect out of your employees? That's a good way to get some data. And then behavioral experiments. So he can purposely inform his boss about his performance and see how his boss reacts to that. So all we're doing is we're trying to get him some data to either prove his belief or refute it. Because right now it's purely speculation. So his core belief is, I will be fired soon. So we want to track that belief as we work with his underlying belief and automatic thoughts. So this is how we come up with coping thought. So we have the distressing thought goes here, the coping thought goes here, and the evidence for this coping thought goes here. And what this is just an example of different coping thoughts, so it helps guide the client. So the distressing hot thought is, I can't keep up with this job, and the coping thought is, I am meeting expectations because there's a learning curve, my boss praises me, and my coworkers tell me what I'm experiencing is normal. So, trying to save at least a minute for questions. That just helps identify some emotions. Clients have a hard time identifying their emotions. This is a positive data log. So we've developed an alternative healthy core belief, which is, it is unlikely I will be fired soon. Brian does not believe in this belief, not at all. So we're going to collect data that supports that belief. And over time, it's our hope that that data that we collect will increase his belief. And we're going to track his belief on this sheet. So his existing core belief, I will be fired soon. How much does he believe in this? 80%. His new core belief that we're trying to give him, so we're trying to build a new schema here. It's unlikely I will be fired soon, and these two are interrelated. So if he believes this 80%, then he only believes a new belief at 20%. And it's our goal to see that increase. Okay, any questions?
I had one question.
Yeah.
Earlier in the presentation, when you mentioned the environment, and if you discover that there are things, like if the client's living in a toxic environment, you want them to develop a plan. What do you do if you are working with children or adolescents and they really don't have as much control over their environment?
So that's a very hard one. So what I do is I only work with what I specialize in. So in that case, my answer to you is I would refer to a child therapist. I would refer to someone who has specialty in that. So one thing that I decided early on is that I'm going to get competent in what I like. And that kind of sounds selfish, but and I'm not going to treat what I'm not competent in treating. So I can come up with some suggestions for that, but they're not really based on experience or, I guess, anything evidence-wise. So I usually don't deal with children who are lower than the junior high level, because usually they have some sort of control over their environment at that age. Usually elementary and down, there's not a lot of control there, so I usually don't see clients that young. Go ahead.
I have a question that's similar. CBT isn't for everybody. I mean, with some people that don't want to do the homework or doesn't have that much insight into their own thoughts.
Yeah.
I mean, do you believe that you can use it for everybody? Like, what do you do if the clients aren't willing to go do the homework?
So I have clients who are unwilling to do anything for various reasons. They don't want to do homework, maybe because they're not motivated.
Mm-hmm.
There's a functioning impairment, and you have to modify. So sometimes we don't even pull these sheets out. We just verbally do the sheets, or I'll have them dictate on a recorder there if they don't feel like writing. So I heavily modify CBT to fit the client, and that kind of goes into that person-centered approach. So I don't say this is the treatment plan and this is what you're doing. So we always modify it, even to the point where I'm doing psychoanalysis with the client right now, and that's not even, it's a part of CBT, but we're doing peer psychoanalysis right now. So that just shows you how flexible you have to be when you're doing CBT.
That was another question I had. I had a client that I was using the CBT approach with, and then we got into a point in our therapy where there were no new journals for me to give her, no new techniques to discuss, and she was like, okay, well, we're done.
Yeah.
But she still had all of these issues, and she couldn't, grasp the idea that just because you're not learning new techniques that therapy isn't over. So how do you get clients to continue to engage in the therapeutic process once the teaching of the techniques is over?
Mm-hmm. So we do that by two ways. Number one, we gauge how their belief is increasing. Once they hit a certain percentage with their belief, then we can mutually agree that you've reached your goal. Now, if that's not a factor, what we do is we work on always making sure the gap is widened. So an analogy I have is when you get off a train, there's a little bit of a gap before you step on the platform. We always want to widen that gap. And what that means is we always have to show them a more ideal them. So when they start getting comfortable with their progress, we praise them for that. This is great progress you're making, but you could be even better. You could, and realistically, we're not striving for perfection of our clients. We ourselves are not perfect, but we're always striving to make them a better person to a certain extent. So if we can keep widening that gap to the point where we get them to their ideal them, then that motivates them to keep coming back. Because they may be totally over all the issues they came into therapy for, but maybe they're just not as productive as they used to be. They're happy, they're not depressed anymore, but now they just have low production. So we widen that gap and we say, okay, let's focus on your productivity now. Evaluations. What do you guys think about? So kind of synthesizing, analyzing, evaluating, maybe a philosophical approach. What do you guys think about what was presented today? And how it fits with you? Go ahead.
Well, I mean, I do enjoy some of the CBT stuff. I think sometimes it gets a little convoluted. I mean, it's pretty complex, and then to have a client to learn all of this, track all this, and like you said, I appreciate that you modify it. I think that's awesome. But I think sometimes, you know, depending on the client, just depending on something, it just seems like there's so much to it.
Yeah.
And I think that can be overwhelming.